Hello, friends. We are living in very, very difficult times. On the one hand, there are rising illnesses all over the world, including India. And on the other, there are rising healthcare costs, which the common people have to bear it. In India, 38 million people die every year due to non-communicable diseases, out of which 82% of these deaths are in the middle and lower income groups. And 16 million people die before the age of 72. And also 58 million people die every year due to diabetes, cancer, heart failure, stroke, and respiratory diseases. In this video, I will discuss these issues and also try to figure out a solution. I've got two requests to make. Number one, please watch the video till the end. And if you like the video, please give a like and also share the video with your friends. I also request you to subscribe to my channel and hit the bell button so that you get the latest notifications whenever I upload new videos for you. So let's get into it. Let's talk about the health emergency. So here we will talk about the present health situation. Before that, let's understand the various categories of illnesses. First, you have the communicable disease. Now, what are communicable disease? Communicable diseases are those which transmit from one person to the other and spreads in the society. You can call them infectious diseases. 38% of Indians die every year due to communicable diseases. They could be due to spread of pathogens in the air, for example, malaria, dengue, COVID, influenza. Then you have the pneumonia, the HIV/AIDS, the TB, typhoid, and hepatitis. Okay. Then you have the non-communicable disease, which does not spread from one person to the other. They are very serious in nature, and 52% of deaths occur in India every year. We call them comorbidity. For example, cardiovascular disease or CVD. Then you have cancer. Then you have COPD, diabetes, hypertension, cholesterol, thyroid, obesity, and osteoporosis. And the final category is injuries. We call them accidents. They could be due to natural calamities, domestic accidents in the house, or road, air, motor accidents, or even workplace accidents. Now, deaths due to accidents in India is roughly 8 to 10%. And here the common people are vulnerable to all these categories of illnesses or diseases. Thankfully, health insurance covers all these categories of illnesses or diseases. Now let's look at the real picture of health in India. Here we have the health statistics for 2022. Let's look at the top causes of death. First comes cardiovascular disease or CVD. It is 272%. Then comes cancer, second, 100%. Then COPD, 73.7%. Then death due to stroke, 54%. Then diarrheal diseases, 38%. Lower respiratory infections, 30%. TB, 24%. Diabetes mellitus, 23%. Then cirrhosis of liver, 22%. And accidents, 11%. And there are many more. Out of these, cancer is spreading fast and furious. India is going to be the epicenter of cancer in the world, followed by diabetes. Experts say India is going to be the diabetes capital of the world. So we have to be very careful. And what are the projections? And what do the experts say? Next year, that is 2025, about 19 crore people who would be above 60 years will need higher healthcare expenditure. So the expenditure is going to rise. Then by 2025, there would be additional requirement of nearly 18 crore hospital beds. And very important, next year, about 3 to 3.2 crore people would go below the poverty line for spending on healthcare from own pockets. This is very, very scary. Let's look at the present healthcare inflation. Here you can see there's a constant rise of expenditure in healthcare. For example, for gastrointestinal diseases, there is a gross increase of 15.4%. Now, these have been calculated from 2013-14 to 2017-18. You can see the figures. Infectious diseases, nearly 19% increase. Cardiac disorders, of course, there's a dip of 14%. But right now in 2024, the cost of cardiac disorders or cardiac healthcare has really shot up. Then you see the expenses for cataract and injuries due to fractures and dislocations. All are shooting up. The price is shooting up. The inflation is really, really high. Let's look at the rising medical costs in India. Right now, the medical inflation is 14 to 16%. And perhaps it's not going to come down anytime soon. So here are the figures. Here we have conservatively taken the costs in Kolkata, where the healthcare costs are comparatively less as compared to Delhi or Gurgaon or Punjab or Maharashtra or elsewhere. Here the projected increase has been 12% and not 14 to 16% in the hope that the inflation would come down. But conservatively, we have taken it as 12%. So for example, the ICU charges in 2024 in Kolkata is 12,000. Just see the figures, how they are increasing over the years. 2030, almost 24,000. 2035, almost 42,000. 2040, almost 74,000 per day, right? For single room cabin in 2024, 5,000. In 2030, 6 years from now, it's going to double, almost 10,000. And 2035, more than 17,000. And 2040, almost 31,000. So you can see the doctor's visit, knee replacement surgery, hernia surgery, bypass surgery, kidney stone surgery, etc. So you can see how the costs are going to increase over the years. And this is very important. The healthcare inflation right now is 14 to 16%, right? Whereas the income increase is only 4 to 5% of normal common people. And you can see the gap. So here is the scary picture. So what are the solutions? On the one hand, there is steep increase in diseases and illnesses. And on the other, you see a steep increase in healthcare costs. The only way we can protect ourselves is by having good health insurance. A health insurance is no more a luxury. It is a necessity, number one necessity. So spread the message across your friends and relatives to have a good health insurance in the first place, right? And the other solutions are lifestyle management. For example, having a healthy lifestyle, doing physical activity, doing physical exercises on a regular basis, balanced diet, that is very important. Then do regular medical checkups, and of course, have regular medicines. So it's a perfect storm. Rising illnesses and soaring healthcare costs. And really, it's going to be an unbearable cost of being sick in India, right? I think this video has been quite helpful for you. If you like this video, please give a like and also share the video among your friends to spread the awareness. And also, please do not forget to subscribe to my channel and hit the bell button to get more updates for new videos that I bring to you. Thank you. Stay well.
Thanks for watching the video till the end. Do let me know in the comment section any particular subject you want me to present for your sake. In the end, please do not forget to subscribe, like, share and comment on this video. We will meet in the next video. Goodbye.